Protection and Affordable Care Act, PACA. The final bill, as you know, did not include the Hyde Amendment, the Weldon Amendment, and nor did it include the Stupak language or the Ben Nelson language. So what does the bill contain? I wanted to review with you briefly what the actual provisions of the bill are that relate to abortion. And the first provision is that the states, when they set up their insurance exchanges, are going to be permitted to exclude abortion coverage in the insurance exchanges. And in this past session, as you recall, Missouri passed a law to that effect. The insurance companies that are in the exchanges are not going to be required to cover abortion. And essential benefits don't have to include abortion, and I think the word abortion is missing there. But what this means is that the Department of Health and Human Services, Catherine Sebelius and her staff, are going to be sitting down and setting out what essential benefits must be included in each of the healthcare plans that are going to be part of the exchanges. And in determining the essential benefits, the healthcare law states that abortion does not have to be included as part of essential benefits. Grants to schools for health care are not going to include abortion. Specifically, they will not include coverage for abortion services. Tax credits and subsidies that are offered to taxpayers who are going to be purchasing insurance are not going to be able to be used to pay for abortion services. As you recall, as more people join the insurance rolls and become insured through the bill, the tax credits and subsidies that they're provided by the federal government in order to pay the premiums for these plans are not going to be used to pay directly for abortions. And that's going to be important because we'll see how the distinction is going to be made there with the previous Hyde Amendment. And there are certain state abortion laws that are not going to be preempted, and those specifically are included in the bill that the state laws that are on the books now relating to abortion, like minor consent laws and things of that nature, will not be preempted by the bill. As far as conscience protection goes, insurance plans that are in the exchanges cannot discriminate against doctors or hospitals who refuse to participate in abortion. And governments can't discriminate against doctors, that's local and state governments, can't discriminate against physicians or healthcare providers who refuse to participate in euthanasia or mercy killing, as it were. And we'll see that some of these conscience provisions are lacking as we go forward. So let's talk about the problems with the bill. The first problem with the healthcare bill is a break from the status quo. As you recall, under the Hyde principle, no federal dollars will be used for elective abortions or for health plans that cover elective abortion. Under the new statute, the tax credits and subsidies that are going to be provided to those taxpayers who are unable to afford the insurance can be used to pay for premiums for health plans that cover abortion. Now, the tax credits and subsidies cannot be used to pay directly for an abortion, but they can be used to pay for health plans that include abortion. And this is a major shift in policy from the Hyde principle, which stated that no federal dollars will be used to pay for even health plans that include abortion services. The second concern is the community health centers. Community health centers are basically health centers that provide primary care for the poor. And the statute relating to the community health centers includes family planning services. So obviously there's going to be $7 billion that is appropriated through this bill to the community health centers, and there are no funding restrictions on those dollars. Now, community health centers don't typically provide abortion services. They do provide abortion services in the cases of the life of the mother, rape, or incest, but they otherwise don't typically provide elective abortion services. And in fact, the 1979 federal regulations provide that no federal dollars will be used for abortions in the community health centers, with the exception of situations where the life of the mother is at stake or the mother has been the victim of a rape or incest. Missouri, and the community health centers in Missouri, do not provide abortions, and they haven't provided them in the past, and they aren't going to be providing them in the future. So what is the concern here? If the regulations provide that abortions aren't going to be covered in the community health centers, and Missouri's community health centers don't do abortions, where is the problem here? Well, as I mentioned, the community health center statute includes the terms family planning services, and as you recall, when we talked about the Medicaid statute back in the 1973 and 76 era, the courts, when they interpret family planning services, require the provision of abortion services to be included. And the federal regulations that put limits on abortion services would be trumped by the statute, which is silent when it appropriates the money to the community health centers. It's silent on restricting those dollars as far as it not being able to be used to fund abortion. Now, some might argue that this is a hypothetical concern, and it's not one that's even really going to be in place at this point because no one is challenging those laws. But we did have a situation this summer that really pointed out this concern with regard to unrestricted dollars. And that happened this summer. And what happened was one of the first programs that was going to be set up through the new law was the high-risk insurance pools. And as you recall, a lot of people that are uninsured right now are uninsured because they're at high risk, or they can't get insurance, or they've exhausted their insurance, and therefore they're uninsured. And one of the first plans to be set up are the high-risk insurance pools in the states for these individuals. And money was appropriated for that purpose over the summer. And several states, including Pennsylvania and New Mexico, and there's one other state I can't recall specifically, but they had set out in their websites that their high-risk pools were going to include abortion coverage. And fortunately, the General Counsel for the USCCB jumped on this, and they made an argument that this was inappropriate, that the bill did not intend for these dollars, with not only the health care bill, but the executive order would state that these dollars shouldn't be used to pay for elective abortion in these high-risk insurance pools. And the Department of Health and Human Services agreed, and ultimately they decided they wouldn't include abortion in these high-risk insurance pools. But Planned Parenthood and the folks in the pro-abortion lobby were really upset about the fact that they felt that this went way beyond the bill. This went way beyond the executive order. And so the point that I'm making here is that this points out the concern with unrestricted dollars within the bill. When there's no limitation on what those dollars can be used for, you're going to have states that are going to want to set up plans that include abortion when that was not the intent, or shouldn't have been the intent of the bill in the first place. So this is why these unrestricted funds in going to the community health centers are of a concern to the bishops. The third concern has to do with the insurance exchanges. And there are going to be some health plans within the insurance exchange that offer abortion services. And the statute specifically states that those plans that offer abortion shall collect from each enrollee a separate premium for abortion services. So this means that any consumer that purchases an insurance plan that includes abortion, that consumer must pay a separate premium for abortion services, whether that consumer wants abortion services or not. And so if you're in a situation where you go into the healthcare insurance exchanges and you're in a state where each of those plans includes abortion, or the plan that works best for you includes abortion, you must pay a separate premium for abortion services, even if you have an objection to that. And there's no conscience protection for you. You don't have the right to opt out of that. If that plan includes abortion and it's the plan that works best for your family, you must pay. It's mandatory. You must pay a separate premium for those services, whether you want them or not. So effectively, you would be funding other people's abortions. And unfortunately, the statute is very specific in stating that the notice of this provision is only going to be, in other words, you're only going to be noticed as part of the summary of benefits. You will be noticed about the fact that abortion is included in the health plan. There's not going to be a red flag. You're not going to sign a waiver form or any kind of instruction. And in fact, the statute states that the premium dollars that you're told about, you're only going to be told this is how much your premium is. It's not going to break it out as to how much goes for the plan, how much goes for the abortion. It'll only be a $1 premium amount, and you'll only have notice of the fact that your plan covers abortion as part of the summary of benefits, which is just inadequate notice. So, the fourth concern has to do with conscience protection. And although the healthcare plans are not going to be able to discriminate against doctors who refuse to perform abortions, the statute is silent as to whether state and local governments can discriminate against doctors who refuse to perform abortions. So that's a loophole in the law that needs to be fixed. Also, contraception, there's a question as to whether contraception will be required as part of preventative services. Just like essential benefits, the Department of Health and Human Services is going to determine what preventative benefits are going to be covered under each of the health care plans, and they're in the process of determining that now. Preventative services includes things like Lipitor, or drugs to lower the cholesterol level for people with heart disease, or blood pressure medication, things of that nature to prevent disease, mammograms, annual physicals, things of that nature. These are preventative services. And contraception is an issue that the church has a problem with, obviously. And the USCCB recently sent a letter to Catherine Sebelius asking her not to include contraception as part of preventative services. And they made three arguments. First, they said that contraception is not preventing a disease process. Pregnancy is not a disease. It's a normal functioning part of the female reproductive system, and so it's not a disease process. Second, contraception in many cases can cause other problems. It can actually create diseases that preventative services are intended to prevent. And so that was their second argument. And third, they argued that there needs to be conscience protection for those health plans that do not want to provide this as a matter of religious belief. The Catholic Church has never offered contraceptive services in the health plans that it offers to its employees, and so they want to be able to continue that practice because they don't believe contraception is moral. Another conscience protection concern is that the statute fails to include a provision that would prevent the Secretary of Health and Human Services from excluding healthcare providers who refuse to participate in abortion services, so that when Catherine Sebelius and her staff are selecting physicians to participate in the health insurance exchanges and determining which physicians will be permitted to participate, there is no provision in the statute that would prevent them from excluding physicians who have a conscience objection to performing abortion services. So that's another loophole that needs to be fixed. And the new law does not protect state conscience protection laws. It states that the new law will not preempt state abortion laws, but it doesn't state that the new law will not preempt state conscience laws, and that's another loophole that needs to be corrected. So let's review the problems with the new bill. First, as we discussed earlier, the tax credits and subsidies are going to be used to pay premiums for health plans that cover abortion. That's the first concern. The second concern is the $7 billion in unrestricted funds that are going to be appropriated to the community health centers. Obviously, those funds, if challenged, could be used to fund abortions if the courts were to review the statutes, which are vague, like the Medicaid statutes. The third concern is that those consumers that are going to purchase insurance plans that include abortion are going to have to pay a separate premium for the abortion services, whether they want that service or not. And so that's a concern. And so the third concern is that there is not comprehensive conscience protection for doctors, hospitals, and health plans. And this includes Catholic insurance plans through the diocese of the Catholic Church throughout the country. As we discussed earlier, that their conscience protection is not provided within the bill. And following the healthcare debate, Cardinal Francis George, the president of the United States Conference of Catholic Bishops, issued a statement after President Obama signed the bill into law, stating that the bishops have opposed the bill throughout the course of the debate because the statute is flawed regarding the abortion and conscience protection issues, and that the existence of the executive order actually points to the deficiencies in the bill.